Today I'll be performing hand hygiene. Just going to close this curtain to give us some more privacy. Hi, how are you today?
Good.
Good, I'm Haley. I'll be your student nurse. I'll be doing a head-to-toe assessment on you as long as that's okay with you.
Yes.
Okay, and ask if you can squeeze both my hands for me, please. Okay, great. And what is your name?
Madison Perneski.
Date of birth?
March 12th, 2002.
Do you know the date today?
March 29th, 2020.
Do you know where you're at?
A hospital.
And then do you know who our president is?
Donald Trump.
Okay, great. You're alert and oriented ×4, which is great. Okay, I'm going to start off by grabbing your vital signs. I'm going to get your blood pressure first. I'm going to do it on your right arm since it's the most accessible. Just see your arm, please. I'm just going to push this up. Okay. Lay it down if you'd like. Okay. Got 116/74, which is completely normal. Next thing I'm going to do is I'm going to get your temperature. So if you can lift your tongue up, please. Leave it under till it beeps. Okay, it's 98.9, which is completely normal. Next thing I'm going to do is get your pulse. I'm just going to do it on your right arm. Okay. Got your pulse to be about 62, and then your respiration rates to be 12, which are both in normal range. Okay, and then I'm just going to feel your pulse in both your arms to make sure you're getting circulation equally through your body. So I'm going to feel your left. I'm just going to feel them at the same time. Okay, both your pulses feel equal. They're strong bounding pulses, which is great, so you're getting good circulation through your arms. And now I'm just going to check your capillary refills. I can see your right hand, please. Just going to press on your nail. Okay, I notice it comes back in about 1 to 2 seconds, which is normal. Can I see your left hand? Okay, about 1 to 2 seconds too. Alright, the next thing I'm going to do is check out your pupils. So we use this thing called PERLA. It's an acronym that we use just to help us remember. It stands for pupils, equal, round, react to, light, accommodate. So I'm just going to do a couple mini tests on you to make sure everything's working okay. So I'm going to start out just by inspecting your pupils. Everything looks symmetric, they look round, they look equal. I don't notice any abnormalities just by the first inspection. Okay, so I'm going to make sure your pupils react to light equally. To do this, I'm just going to have you stare straight ahead, not look at me, and then I'm going to bring in the light to the side to make sure your pupils constrict. So I'm going to start on the left. Your pupil constricts. I'm going to go to the right and do the same exact thing. Pupil constricts. So your pupils constrict equally, which is good. Now I'm going to do the accommodation test. So I'm just going to have you stare straight ahead. Keep your eyes ahead. Don't focus or move your eyes with this. I'm going to bring it straight back to you. Okay? And they both constrict equal bilaterally. Everything is symmetric, so your pupils constrict equally, and that's all, and bilaterally. So everything's good with that. There's no abnormalities. So the next thing I'm going to test is your head muscles. To do this, I'm just going to have you push against my hand. Okay? Other side. Okay? Back. Alright, and then the front. Okay. Now you tip up please a little. I'm going to test your trachea. I'm just going to have you swallow please. Alright, your trachea seems midline. I don't notice any abnormalities with either of those. Your facial expression seems appropriate. I don't notice any abnormalities. Everything seems symmetric and equal. I don't notice any twitching or tremoring or anything like that. So, the next thing I'm going to do is I'm going to listen to your lung sounds and I'm going to listen to your heart sounds. So to do that, I'm just going to ask you if you could sit up please a little bit and bend over a little. And then when I listen, I'm going to ask if you could take deep breaths and breathe out your nose, okay? Okay, if you could take a deep breath please. Again. Again. And one more time. Okay. And if you could sit straight up, please. I'm going to listen to your heart sounds. You have several points that we listen to. So, I'm going to start out with the aortic, pulmonic, herbs, tricuspid, mitral. Okay. You can sit back again if you would like. I didn't notice any abnormal sounds with either of those. I didn't notice any wheezing or cracking or anything within your lung sounds. I didn't notice any murmurs in your heart sounds. Everything seems to be in with normal limits. I also noticed that your anterior and RML lung sounds also seem to be within normal limits, which is great. The next thing I'm going to have to take a look at is your belly. So if you could lay down completely for me. Then do you experience any stomach pain?
No.
Okay. I'm going to lift your shirt up a little bit. And then I'm going to just inspect it by looking. Everything looks symmetric in all 4 quadrants. I don't notice any swelling or abnormalities just by looking at it. I'm going to start by listening in all 4 quadrants. I noticed all bowel sounds seem to be normal. There's nothing that's hyperactive or underactive, so that's great. And then I'm just going to press on your belly a little. Let me know if you feel any pain or tenderness while I do that. Notice any pain while I do that?
No.
Okay, good. Put this back down for you. And can you tell me when your last bowel movement was?
20 minutes ago.
When's the last time you urinated?
20 minutes ago.
Do you have regular movements?
Yes.
That's great. Okay, I'm going to move down to your lower. So I'm just going to ask, have you been up walking around a lot today?
Yes.
Okay. And then do you have any leg pain or calf pain regularly?
No.
Okay. Do you have any calf pain as I press against it?
No.
How about your right leg?
No.
Okay. Just going to push these up a little so I can have a quick look. Just by looking, I don't notice any swelling or anything like that. I'm just going to palpate. I don't notice any pitting either, so that's also a sign of no swelling. Just to make sure you're getting some adequate circulation, I'm going to make sure I can feel both pulses in both your legs, okay?
Okay.
So the first pulse you have is on the top of your foot. It's called the dorsalis pedis. I'm just going to make sure I can feel it. Okay, I can feel it in your right foot. I'm going to go to your left. I also feel it. Now the second one's closer to the back of your leg. It's called your posterior tibial. Okay, I also feel that one. Okay. Both your pulses are present in both your right and left leg equally. They're both bounding strong pulses, so that's great. You're getting good circulation. Everything seems to be within normal limits as far as I can see. You can sit back up into a comfortable position if you would like. I'm going to perform hand hygiene. And I did want to ask, are you in any pain today?
No.
Okay, good. All right, I have the call light in reach for you. Let me know if you need anything, press that. We can get whatever you need. And then everything I found in my assessment today seemed to be within normal limits, so there's no reason to worry or anything like that. I'm going to go document everything I found, and then I'll be back in about 30 minutes to an hour to check on you again.
Okay.
Okay, see you soon.